The medication Digitalis has been around for many years and used for people with heart disease. Now, scientists have recently rediscovered that men on Digitalis have a decreased incidence of prostate cancer. Would you consider Digitalis a safe off-label use for prostate cancer therapy?
Well, if I was really convinced it works, because it's a stretch to the imagination to think that a drug we've been using for one thing, heart disease, all of a sudden is an anti-cancer drug. But it really shouldn't surprise us much, and we should keep an open mind about that.
And why shouldn't it surprise us?
Well, why shouldn't it surprise us? Because we should keep an open mind. I mean, a drug that does one thing often does 20 other things that we hardly know about. So keeping an open mind about those possibilities just gives you more options that may come up for treatment for something you don't expect. So when it does happen, when we're used to it doing a certain thing, it's a stretch to the imagination to think, gee, this drug we've been using for heart disease, all of a sudden, is a drug that should be used for cancer?
And one of the things that it does is it slows down the heart rate and it makes the heart beat stronger.
Well, it can, so that's why it's used for people who have congestive heart failure, who have certain kinds of rhythm disturbances.
So it just sort of happens to have a side effect of helping people with cancer. What does
You
it
could
do?
look at it
what does
that
it
way.
do for the
Well, we'll
cancer?
get to that in a minute. Let's look at some of, you asked me a question, should we just be using this drug for people who have cancer? Is it safe to do? And if you're talking about prevention, I would say the answer is no, even though I think there's a good likelihood, based on the data that we're going to go over in a couple of minutes, about that. But the side effects that you see can be real problems. I mean, more than several percent, 5–10% of people may have problems with loss of appetite, GI symptoms like nausea, vomiting, and diarrhea, visual symptoms where you have blurred vision and funny colors to what you see. You can become confused and have seizures and nightmares and be agitated, and it can cause lethal cardiac rhythm disturbances. So it's not something you just put in the water and say, let's prevent cancer.
How often do you see these side effects, though?
Well, sometimes in the range of 5, 10, 15%. Maybe the more serious ones, far less than 1%. But when you're talking about treating millions of people for cancer prevention, you're going to be looking at tens of thousands of people who are going to have severe side effects from it. But when you're treating cancer, now that's another story. I mean, the mortality with a lot of cancers is very high. And you might want to take some of these risks because they're a lot less than what you'll see from the cancer itself.
Or less than chemotherapy.
Oh, far less than that. So what we've got here is a story that's really intriguing. Could it be that this drug that we've been using for 100 years, that's derived from foxglove, just a plant, has all these other kinds of effects, and people have studied it, and the way this particular study came up, when they were looking at digoxin, which is a form of Digitalis, they were looking at a number of drugs. They were looking at thousands of different compounds of drugs, of which digoxin was one, and what they found was that there was a much lower incidence of cancer, particularly when they were doing studies on cancer cells in a tissue culture. They put Digitalis in there, and the cancer cells didn't grow at a fast rate. In fact, a lot of them died as they should normally. There's a process called natural cell death, or apoptosis, which means that there's a fixed lifespan for cells. But when apoptosis doesn't work and the cell lives forever, now you're talking about cancers forming, because that's what cancers are. And digoxin in this particular study showed that in people who were on it, that there was a 24% lower risk of developing prostate cancer, because that's what they measured. And for those people that were on the drug more than 10 years, they had something like a 46% reduced risk, okay, of developing prostate cancer.
So this is just kind of an extra bonus then for people that happen to be taking Digitalis for their heart condition, that it
exactly
might help to prevent them from getting cancer.
Precisely. So then the question is are there other studies that have been done in other kinds of cancers? And the answer to that is yes, there's been a lot of study that's been done on that, but it's not widely publicized.
I wonder why.
Well, you're talking about a drug that's no longer on patent, so it can be bought for pennies.
So they're not going to make any money off this.
Yeah, so there's no profit involved with it.
Which to me makes it seem like it's more believable.
Well, it does. It is more believable. When you look at the data, it's kind of impressive. And the question then comes to mind is, well, what is the data? And should we be using it for treating cancer? So basically, when this was originally being looked at a long time ago, say in the early 1900s, people were doing studies. One person did a study on people who had heart disease, who had been on the drug for a while. And what they found was that those people who were taking the Digitalis preparation weren't getting cancer, and they couldn't figure out why. They went back and did a few studies and found out that what the drug actually did is that it lowered the proliferation, the growth of cancer cells, but it also caused the cells to commit suicide in doing this apoptosis thing. That's a pretty impressive thing.
Okay, so then they went from prevention to actually treating it, killing it.
Well, they were talking about what could be done to give us enough of an idea that we should be using this or considering its use in clinical practice for people who have cancer. For people who don't have cancer, too many side effects, too many complications, too many deaths are going to come from the use of the drug. So that's never been an issue.
We're not going to put that one in the water.
No more than we would the poly pill. That's right. So when they looked at the death rates, the global mortality for patients who were on Digitalis, they found that about 0.7% of people per year who were taking a placebo compared to people who were taking regular Digitalis had about a 10 times lower mortality rate. So the people who were on the placebo were getting cancer at the standard rate, which is 0.7% per year. And people who were on the drug, when they looked at the cancer mortality rate, it was 0.06% per year.
Wow, so
that's a huge change in the risk of the risk for getting cancer. And when we looked at other older studies and the people who were on Digitalis for life for heart reasons, hardly any of them died of cancer, which was not expected. But when they noticed that, that's when people started doing more studies. But people who were doing those studies were having a hard time getting their information published because people reacted like I did when you introduced this and said, gee, we have a drug that's used for heart disease and now we know it prevents cancer. And you're going, wow, really? I don't believe that. And then they were skeptical. So they didn't publish a lot of stuff. But back in 1974, a fellow from Sweden did some studies on the effects of Digitalis in breast cancer, and what he found is that people who were on Digitalis at the time of the diagnosis of breast cancer seemed to develop their breast cancer much more slowly. They weren't dying as often, and they were having less in the way of metastases develop.
So maybe this is one good thing about having heart disease if you're put on Digitalis.
That's true.
Is that it'll prevent you from getting cancer half of the time.
Well, more than half the time. It'll prevent it a lot. And in another study of 44 patients who were maintained on Digitalis at the time of surgery, okay, this was a study where they wanted to see what it would do after they had the diagnosis, and they treated them for 5 years. They only found one recurrence of cancer. But in the control group, they found about 9.6 times as many cancers. So we're starting to get the idea that this is a drug that has some powerful effects that we should be paying attention to when it comes to the treatment of cancer. I mean, what's the downside of putting somebody on a Digitalis preparation if they have cancer? It's that they have the same risk of having a complication as somebody who has heart disease. And if you use it in heart disease and you monitor it carefully, it's relatively safe. Although in general, because there are so many new drugs that are on the market, we tend to forget that Digitalis is around. And it's used nowhere near as much as it was a decade ago. Then they looked at the different kinds of Digitalis. Should we use digoxin, which is a common one that people are using? Its trade name is Lanoxin. Or digitoxin, which is another form of it. And what they found was you got different effects from it. So there's a lot more research that needs to be done on this whole subject of using Digitalis for cancers of different types. But the point I would say is, what's to lose? You're dying from cancer of any kind. Why wouldn't you try something that, if it's followed carefully, there's no reason, no common problem that you're going to develop that's got anywhere near the risk of what you're going to see if you have a problem just from the cancer itself. So when people who are developed with prostate cancer or who have been diagnosed with breast cancer or any other kind of cancer, This ought to be one of the considerations that we put in an armamentarium of tools that we use to treat cancer. It's one of the things that may have a future that we should be paying attention to.